Good afternoon, everyone. I welcome you all to another webinar from MTBC about the WebEHR and practice management changes that our IT team has implemented within the system. Let me just first begin by introducing myself. My name is Athar Maksud. I will be moderating this session. Now, before we get into the details, let me first begin by telling you that this webinar is going to educate our clients about the changes that we have implemented within the WebEHR and the practice management system. Now, all the participants of this webinar have joined us by using GoToWebinar service. This service do allow you to ask questions. You may see a GoToWebinar panel on the right-hand side of your screen. If you want to get rid of this panel or if you want to minimize it anytime, you can do that by using the orange arrow that is pointing towards the right-hand side of the screen. If you do have any questions, do not hesitate and feel free to ask as much questions as possible. There is a question section available on GoToWebinar panel. All you need to do is you just need to type your question and submit it. And I will try my level best to answer all the questions at the end of the webinar session when there will be time for question and answers, or if due to the shortage of time, we will unable to answer all the questions that will be asked during the webinar session, we will be reaching back to you by email. Now, just a quick refresher about MTBC before I start. MTBC was founded back in 1999 and is currently serving 70 plus unique medical specialties in 45 plus states across the country. We have got 2,000 plus employees with 24/7 operations. That also allows 24/7 tech support for all the products and services that we offer. We are ranked among the Deloitte Technology Fast 500, and on the top of that, we are in Inc. 500 over 5,000 companies. MTBC have got operational facilities in 3 different continents. That means we have got 3 international offices, and we are also a SureScript certified solutions provider. MTBC is also listed on NASDAQ. Now, let us just go ahead and have a look at the synopsis of webinar. The first change that we have implemented within the system is the patient advisor feature. MTBC has been certified on electronic prior authorization, that is the EPA, and the scorecard of Patient Advisor from Dr. First. Patient Advisor toolbar gives access to critical functionality, clinical content, and other evidence-based diagnosis-specific support services designed to help patients manage their conditions and stay on track with the treatment plans. Moving the EPA or the electronic prior authorization workflow into the EHR is beneficial for both the doctors and their patients as well. Once the medications are approved, the patients will receive their prescriptions without any delay. There won't be any delay, and the patients are just going to receive the prescriptions as soon as possible. It will be applicable to only those patients who have the benefit plan available. That means who have a benefit plan that is the Medicare incentive plan or the Medicaid incentive plan, etc. It offers you the most seamless and comprehensive electronic prior authorization functionality in the marketplace. EPA solution will, first of all, it is going to decrease your business and development costs while attaining multiple EPA feeds through a single connection. It is also going to reduce the administrative burden of providers by as much as 70% when processing prior authorizations. The EPA is also going to enable you to obtain scalable transaction-based revenue for your system. Now, once you are going to log into your MTBC account and you are on the dashboard screen, here's the change that you will be able to administer going forward. You will be able to see the patient advisor toolbar on the top center of the screen. Now, this toolbar is also going to be available within the chart section. But let's say if the client or the provider is not looking forward to going to the chart details of every specific unique patient in order to monitor the EPA or electronic prior authorization, he can just go to the dashboard screen and he can just monitor or evaluate the EPA for a certain group of patients. Now, once you're just going to hit the patient advisor bar or the EPA bar, you will be able to view this screen, and the other widgets, the other gadgets like refill requests, documents, and messages, they will be dropped down. Now, on this screen, the provider will be able to search through 3 to 4 different search options that are, he can be able to search with respect to all locations, all statuses, and all prescribers. The provider will be able to view all the patients for whom he has prescribed the electronic prior authorization, along with the drug name, the date on which the drug was created, and last updated as well. There are some certain action buttons available on the extreme right corner of this pop-up. As you can see, there are about 3 action buttons available that are continue, cancel, and reassign. So let me just go into the details and tell you what these buttons actually do. So for instance, let us just consider first button as an option. That is the continue button. Let's say if there is a certain medication that you want your patient to continue, you can just click on the continue button, the continue action button that is available, and you will be able to see this pop-up right in front of your screen. You just have to re-enter the first and last name of the patient, along with the date of birth and all the other details that are in static form or that you are able to see on your screens at this point of time, and you just need to hit the submit button. Once you're going to hit the submit button, you will be able to see a change, and you can also reassign this task by clicking the reassign action button to any of the other office staff members. Now once you're going to hit the reassign button, you do have to type in the office staff member's name manually, and once you have done doing that, you just need to hit the save button. As you can see on your screen at this point of time, Wayne Best name has been typed as an example. So once the provider is going to hit the save button, he will be able to see that name underneath the assigned to tab or assigned to section. Now there's also a small icon, this small magnifying icon available right next to the drug name. You can just click on that icon and you will be able to see the entire drug history. You can use the print command button to print this out for your own convenience. You will be able to print this chart that will include the patient information, the prescription, and the prior authorization information as well. Now moving on, let us just talk about the other feature that we have within the Patient Advisor tab, that is called the scorecard. The scorecard has been provided in Plan of Care Medication section. Adherence rate is an indicator of how closely the patient adheres to filling their prescriptions. The adherence rate compares expected refills with the actual refill history of the patient and expresses the difference as a percentage. It will first of all provide a graphical representation and monitoring patient medicine intake. Secondly, it is just going to identify patients who may be at a greater risk of non-adherence. And last but not least, it is just going to review patient-specific scorecards with patient's prescription history. Now, the screen that you're able to see in front of you at this point of time is the charting screen. We are specifically talking about the Plan of Care Medication tab within the chart section. Now, as you can see, there is a Patient Advisor tab available within the same screen as well. Now, this Patient Advisor tab is specifically for a specific unique patient. Once you're going to hit the Patient Advisor tab, there will be an option where you can just check the box that will indicate that you need to find the prior authorization or the scorecard for this specific patient. Once you're going to click on the patient scorecard, you will be able to view all the prescriptions that you have been giving to that patient in the past, and you will be able to view the start date and the end date for that prescription. Let me just give you out an example over here. Let's say if you just prescribe a prescription to a specific unique patient and you did tell the patient to get a refill for that specific prescription, but in case if he does not take any refill or he does not refill that medication, then you will be able to see a red bar, a red line that will indicate the gap section. Now, in order to study this graphical representation or the legends, you can just use the chart legend tab that is available, the chart legend option on the right top corner of this pop-up, that will just further explain or identify the icons that have been used, the symbols that have been used within the screen. The first one is like prescription start, that is the RX. In the same manner, when the prescription is going to end, you will be able to see an X symbol that will identify that the prescription has stopped, and as I've told you, the red bar will indicate the gap section. Similarly, if the patient does avail the refill option, you will be able to see an F symbol that will indicate that the actual refill has been availed by the patient. Now moving on, let us just talk about some of the other changes that we have implemented within the WebEHR. The first one is the last vital signs in the charts. Now on clicking the last vital button, you will be able to view the list of all the last vital signs of patient charts into a small window against visit dates along with the vitals for the last date of service. This way you can just view the vital signs against previous visit dates and apply them in the latest chart. Now obviously when you're about to create a new chart for the patient, the system will automatically replicate the past vitals that you have entered within the chart section. But let's say if you are not looking forward to add those vitals and you are looking forward to add any other vitals from the chart prior to that you have created within the system, you can just use the last vital button that has been highlighted on your screen right now, and you can just select the date of service, that is the visit date, along with the vitals that you want to apply within the chart section, and you can just use the apply button in order to do that. You will be able to replicate or overwrite the weight, the height, the BMI will be calculated automatically along with the blood pressure reading. Now another change that we would like to talk about during this webinar session is attaching CCDA to the patient documents. Now you can directly attach CCDA files to respective patient documents. You can attach a CCDA file in CCDA import section, and that's how you need to do it. After clicking display, the CCDA file will be imported, and at the bottom a new button save in the documents is added. Now I'm just going to show you how that button works and what is the use of that button in the upcoming slides. Now upon clicking this button, a new pop-up will appear where you can add more details regarding the attachment. This particular document will be attached in the respective patient's document section. Now this is the CCDA import and export screen where you need to go first in order to import any CCDA document. And once you are going to do that, you will be able to see that CCDA document. Once you are going to hit the save in document button that is available on the bottom corner of the screen, you will be able to see this pop-up, that is the view and attach pop-up. Now this will indicate that the document has been saved within the documents tab for that specific unique patient. Now if you just go to the documents tab, you will be able to view or edit or download the document, the CCDA report that you have uploaded within the system by using the CCDA import and export screen. Now there is one more feature that is called the chronic care in patient demographics that has been added within this WebEHR system. Now how this feature works is a new checkbox of chronic care is added within the patient demographics underneath the patient status section. A color legend of chronic care patients is added in the patient search as well, so you will be able to distinguish that which are those patients that do need the chronic care or which are those who are the chronic care patients in actual. So it is also added in dynamic report section, and you can pull the report for all the patients who are the chronic care patients within the entire reporting period, or you can just select a specific time frame and you can just pull out the report by going to the dynamic report section. Now here is the patient demographic screen. If you just have a look at the bottom corner of the screen where you are able to see the chronic care option that has been highlighted. Now here where we have just enabled this feature, and you will be able to check the box for the chronic care patients, and this will indicate that this patient is a chronic care patient. In the same manner, if you just go to the patient search for all the patients you have checked the chronic care box, you will be able to see a red box along with the patient account number that will indicate that this patient was a chronic care patient. Now similarly, as I've told you before, you can also get hold or access the entire report for all the list of chronic care patients by going to the reporting tab Underneath the reporting tab, you will be able to see 4 different drop-down menu options. The first one is financial, the second one is finance analysis, the third one is EHR, and the fourth one is billing analysis. Now, if you just have a look underneath the EHR section, you will be able to see the dynamic report. And once you're going to hit the dynamic report tab, you will be taken over to an entire different screen where you can just select the chronic care option from the left box, the left section, and you will be able to generate the entire list of chronic care patients. Now, there's one more advancement that we have done within the WebEHR, that is enhanced search option in the Office messages. We have enhanced the search feature in the Office messages for you. For example, now you can search in the body and subject, search in the subject only, and search in the body only. Now, you can also apply from, to, and CC filters. That is the carbon copy, or BCC, that is the black carbon copy filters. Now, let's say if you are unable to track any message from the Office staff members within your MTBC account, or if you are finding it difficult prior to this, now you can just search for the Office staff members' messages easily by using the search filter that has been enabled. You can just use the search filters like from, or to, or CC, or you can just type in the subject like what specific messages you are looking forward to search. Now, as you can see on your screens at this point of time, the search filter indicates that search, there are about 3 different search options. The first one is search in body and subject, search in the subject only, and search in the body only. That is only for the Office staff members. Any Office messages that you haven't read or you're unable to find, so you can just go ahead, use these search filters, and you will be able to track down the Office messages. Similarly, if you talk about the chart assessments print, this is the new thing that we have introduced within the WebEHR. Now, an option is there to print only chart assessments for the providers. Let's say if somebody is looking forward to print out only the assessments he has performed, then he can just use the print button in order to print out the list of all the assessments for that specific unique patient. You can print single or multiple assessments by clicking the radio buttons provided at the beginning of each assessment. Moreover, you can print all the assessments in the chart sections by clicking all radio button, or if you just choose the current radio button, you will be only able to print out the current assessments. Or if you just want to print out the past assessments for that specific unique patient, you can just use the past buttons. And similarly, there's the other radio button available as well. So if you just want to print out the other assessments for that specific unique patient, you can do that. Now, this screen further elaborates how you can just print the current chart assessments. All you need to do is there are about 4 radio buttons that has been highlighted, all current, past, and others. So you can just select any one of those, and you can just select which assessments you are looking forward to print, and you can just click the print command button that is on the top right corner of the screen, and you will be able to print all the assessments that you're looking for. And once you're going to hit the print command button, you will be able to see this screen where as you can see, this provider that we have used as an example was trying to print the current assessments, the past assessments, and the other assessments. So he will be able to incorporate all the assessments on a single piece of paper, and he can just print that out. Now let us just talk about the exam details. An exam detail option has been added in the document section. While attaching a document with document type as consent, labs, and x-rays, a linking name exam details will appear. On clicking this link, a pop-up will appear, and you would be able to fill up the necessary information. You can also view the exam details in health summary section. Now I'm just going to go ahead and show you where exactly in the health summary you will be able to see the exam details option, and let me just show you where exactly in the document section you will be able to play around with the exam details feature that has been added up. Here is the document screen, or the lab imaging order screen, where you will be uploading any of the lab imaging order. Let's say once you will be doing that, underneath the type section or the type radio button, you will be able to see a drop-down menu that will further explain the consent, lab, or x-ray. If you just select any one of these 3, you will be able to identify the exam details. Now, as shown on your screen at this point of time, the provider did upload the exam detail form, any of the image results that he did upload within the system. After that, once he specified the consent, he can just click on the exam detail button, and he can just identify that whether this exam was mammography or colonoscopy. Similarly, as I've told you before, underneath the health history, you will be able to see the exam detail option, the exam detail widget, where you will be able to identify the exam detail that you have specified within the Documents tab. Now let us just go ahead and talk about the major practice management system changes that we have implemented within the practice management system for all the clients. Now the first one is restrict duplicate patient records. Now, through this change, provider can restrict duplicate patient records to be entered within the system. Duplicate patients are detected on the basis of first name, last name, and date of birth, obviously, and the providers still have provision to continue with duplicate patient records if he wants to proceed anyway. This change has been implemented on patient demographics and the scheduler screen. Now, let's say if the provider is about to enter a new patient and he is not sure that whether this patient has been created within the system or not. Let's say if a patient visits the provider's office today and he just disappears for the next 5 years, and let's say he just shows up after the 5 years of time, so the provider will be able to identify before creating the patient through this pop-up screen. He will be able to know that this patient already exists within the system. If he wants to create that patient anyway, he can just choose the create new patient anyway button, or if he wants to cancel that, he can just cancel that and he can just work on the existing patient that was created within the system before. Now similarly, this screen also shows the same steps, the same methodology that I've explained to you about. If the provider wants to update the existing patient, he can use the update anyway button, or he can just click the cancel button and he can just search for the existing patient and he can just work on that, because that patient will already be there within the system. That's why he will be able to see this pop-up screen. Now, if we talk about the scheduler screen, obviously, I mean, if you have scheduled the appointment for any of the patient in the past, but you are unable to recall that or remember that whether you have created the appointment within the scheduler screen or not. So once you're about to create the appointment for the same patient again, the system is just going to show you this pop-up that will indicate that the appointment has already been created for this patient in the past. So if you still want to create an appointment, you can just choose the proceed anyway button and you will be able to create an appointment. Otherwise, you can just cancel that. Now, there is also the new position for notification messages that our IT team has worked for. Now, if you do receive any new messages, you will be able to see the notification on the welcome screen. I'm just going to show you how it will look like. The position of notification messages has been changed so that the providers can notify of important messages like invoice reminder and the maintenance activity. Let's say if there's any sort of maintenance activity going on within the WebEHR system or the practice management side, the provider will be notified about it on the welcome screen. So he will have a clear idea of what is going on within the next couple of days, or if he's unable to access any of the tabs available within the WebEHR section, he will be able to identify those as well. Now, provider can view notification from any page, and provider can hide notification for any active session. Now, here is the welcome screen that we were talking about. Let's say if the provider is running short on the monthly invoice and he needs a reminder about that. So now he will be able to see a pop-up window that will appear, a pop-up message that will appear on the welcome screen, and the provider will have an option to just close that if he just wants to overlook it, or if he has just understood what this pop-up message says, he can close it either way. And any other important updates for any maintenance activity going on in the next couple of days or currently, he will be able to see the notification pop up for that as well. Now, there's also a new feature that has been added up, that is the enhancements and patient payment report. To keep better records of patient payment, certain enhancements have been made. First of all, a new column, patient source, has been added up, so the provider can get an idea about the source of the patient, either if it is a copay or the patient responsibility, so he will be able to identify that. And on the top of that, the existing column, payment type, will now show the type of the payment that has been made after the date of service or after the visit. That can be a check or a credit card or cash. Now, here is the payment source and the payment type that has been highlighted on your screen in order to make you understand what exactly the change is about. As you can see underneath the payment source, patient has been selected as a default option, and payment type has been selected to cash. So this indicates that the payment was made by the patient and it was made in cash. Now, there's also some enhancements in birthday report. A new drop-down of location has been added on the birthday report screen. The new drop-down location contains the location of the provider. Provider can filter and find patients according to his location. If no location is assigned to patient while creating patient, then provider can find the patient by selecting the all locations. There is an all location radio button available, so if he just wants to search the birthdays for his patients or her patients throughout his locations, he can just use the all locations button. Now, if provider do not want to change the existing flow, then he can select all locations from location drop-down. That's what I just told you about. Now, here is the birthday report screen. The provider will have an option to just specify a single location for which he's looking forward to see the birthdays for his patient, or he can just use the all location tab, hit the display button, and he will be able to generate the entire report in front of himself. Now, there's also a new denial reason, that is the patient unknown to the practice is added in the prescription manager. Now, let's say prior to this, if by mistake the providers do receive any prescription refill requests from the pharmacies about the prescription refill, then they can deny that, obviously, and they can just approve that as well. But now a new denial reason has been added up that is called patient unknown to the practice. Let's say if by mistake the pharmacy has sent a prescription request to the provider, and that patient is not someone who the provider has encountered before, so he can just deny that request. Now, here's the screen where he will be able to see the new prescription request, and let's say if that was for any of the patient that the provider has not encountered in the past and it has been sent to the provider mistakenly, so he can just deny that and he can just select the reason that this patient is unknown to my practice, and that will indicate that this prescription request was denied. Refill request was denied. Right, there is one more feature, that is transcription module fixation for Google Chrome version 45 and above. Now, Google Chrome version 45 and latest has stopped support for Microsoft Silverlight, but we have overcome this issue by providing a multi-uploader, which will help you to upload multiple files upon selecting provider and clicking the upload file link. Now, let me just show you how that works. Now, here is as you can see on the left corner of the screen, the provider tab has been highlighted, so you can just select the provider name and then you can just click on the upload file button and you will be able to upload that without any trouble. Now, here is the list of upload files. Let's say if you are looking forward to upload multiple files, you can just have a look at those, and you can just either hit the upload button, or let's say if you are not looking forward to upload a couple of files from this list, you can just cancel those individually, or you can just cancel all the uploads as well. So you have got 3 to 4 multiple options to play around with. Now, let me just go ahead and incorporate all the questions that we came across during this webinar session, and I'm just going to answer those accordingly. Now, the first question that was asked during this webinar session was from a provider who was looking forward to ask that why would you forward vitals from day to day? I would like to see it cleared for the new date of service. Obviously, when you're going to create a new chart, let's say if it is the first chart that you're creating for any of the patients, you won't be able to see any of the vitals. But if it is his second date of service and you are about to create a second chart, you will be able to see the past vitals from the chart, but you can just clear those. And if you just want to override those, or if you just want to replicate the past vitals from any other date of services, if the patient do have 3 to 4 different date of services, you can just click on the last vital button, and you can just choose the vital signs that you're looking forward to enter within this chart from the past date of service, and you can just simply click on the apply button and you will be able to enter the vitals accordingly. Alright, another provider has asked me this question, that when you print the authorization screen, does it also attach right into the chart? You can just print the entire list of electronic prior authorizations by clicking on the magnifying glass that I showed you, and you will be able to print out those accordingly, and that will show that you have printed that successfully, and it will also be updated within the chart section. Now that's all pretty much from my end. If you have got any other questions, any other comments, you can just contact us at info@mtbc.com. That is via email. If you want to ask any questions via telephone, you can just contact us by using the landline, that is 732-873-5133. The extension is 308. And for all the attendees who have joined us a bit late during this presentation, you don't have to worry about it, because this webinar will be recorded and it will be available to stream online on MTBC's website within the 1 week of live broadcast. And you can just access all the webinars that we have hosted so far in MTBC by logging on to our website, that is www.mtbc.com/resources/webinars. And you can listen to any of the webinars that you have missed, and any other webinars regarding the ICD-10, the other webinars, the trainings that we have hosted here in MTBC. Now, I thank all the attendees for taking out time to join us in today's presentation. I hope this presentation was pretty much helpful and informative for all of the viewers. Thanks, and you have a blessed day.